According to the Child Welfare Information Gateway, it says there are 400,540 children currently in foster care across the United States. Many of these children will be put on the list for adoption, but unfortunately, some will not have a forever home before aging out at 18. I did a personal survey of family and friends, and more than half only knew the disadvantages to the foster care system when searching the internet sources via Google. Many times it would pull up information about foster parent disadvantages. As a foster parent currently in the state of Texas, I am able to see firsthand how the foster care system is a great thing and how it can also be a horrible thing for children and parents alike. Today, I will be discussing what the pros and cons of foster care are. I will discuss why foster care is important for some children. First, let's look at why foster care is important to have. Foster care is important to have for children who are living in an unhealthy environment to be taken out of those conditions and placed into a home that is safe. It provides stability to neglected children, provides opportunities to grow in a positive setting and learn positive behaviors. It helps with education, employment, and financial management and housing once the children are of age. While providing stability is important, some children in the foster care system are not always thinking ahead for their lives. Since some children end up being a long-term ward, meaning they were never adopted by a forever home, the foster care system allows any child to stay in the system until the age of 20, so they are able to transition into adulthood. The system also offers treatment and supervision with trained professionals. According to the Department and Family of Protective Services, there are many types of foster care services, which include emergency care, which is a placement of a child that must be removed immediately. Long-term care is when events make it impossible for the child to return back to the parents. Short-term is for children that have all chances of returning home, which they stay for a few months to a couple of years depending on the case. Pre-adoptive care is when there might be no available family to adopt. Parents are in the process of having rights terminated, or the birth parents are making sure their decisions are final regarding the placement. Respite care is a temporary rest for the child away from the caregiver. This is a short-term care. Therapeutic care is a supportive family setting for children waiting to be reunited with parents or until a permanent placement adoption is arranged. This type of care specializes in physical, emotional, and social needs of the child and/or children. Fost-adopt, also known as foster to adopt homes, is a home that is to spare the child another move when adoption is valued as a likely outcome. Kinship home is a family member's home the child may go to for a short or long term. This is always one of the first options when children are removed from the birth parents. While CPS tries to keep siblings together, that does not always happen. Many times children are bounced from home to home, being overmedicated due to so many changes. While there are a few good things about the foster care system, there comes many disadvantages. According to the Spruce.com, an adoption foster care analysis and reporting system, the average age for a child to enter the foster care system is 9. 52% are male and 48% are female. With many children coming into the system daily, having no chance to return back to the home, 11% spend 5 years or more waiting for a family. This equals to 43,083 children. Nearly 30,000 children age out at 18 without ever finding a forever home. Many times the children receiving counseling or any other form of therapy are often given multiple prescription medications. With many children in foster care, it can be an emotional strain, not only on the children, but the foster parents and the biological parents as well. Some other issues with children in foster care include dishonesty, cursing, sexualized behavior, insecurity in the foster homes, and a lot of paperwork and training for the foster parents. While there is many children in the foster care system that may never go back to their parents, many children will or at least be able to go to a kinship home. I've shared with you today many positives and negatives of foster care. I hope this has been a learning experience and informed you of some things you might not have known. Not all children in the system are going to fall through the cracks and will be adopted by a loving home. Many stories can be found on the internet by looking at success stories on foster care children.